There, Dr. Andrew Gorecki, physical therapist, this month talking about lower back pain. And this first video in a series of 3 is going to be talking about how the lower back is designed and what the anatomy of the lower back looks like. So we're going to use our handy dandy anatomy app here, and we're focusing on this region right here, L5, L4, L3, L2, and L1. And that's the lower back. And you can see here that each segment, each one of these is an individual bone. So you can see here's a vertebrae, and that's the body of the vertebrae, and this is the back of the spine here. And this right here is called the facet joint. And that facet joint is where the motion occurs in the spine. That's how the spine is able to move. Each side has a facet joint, and these two little flat pieces of bone slide on each other. And let's say, for instance, when you bend your spine to the left, this one slides down, this one slides up. When you rotate your spine to the right, this one slides up, this one slides down. When you flex forward, they both slide up, and when you extend back, they both slide down. So those are facet joints. In the middle of the spine of these bony vertebrae, you have what's called the disc. This does not show the disc, but the disc is in between the bone, and the disc is kind of like a crab meat material, like a shock absorber. And you can see here that if I hit the nerves, lots of nerves, but pay special attention to, you see that nerve right there? There's a white sheath around that nerve. That nerve is coming directly out of the spinal cord. It's called the nerve root. And that actually leaves the spine in this little hole. It's called the neuroforaminal hole right there. That hole is affected by the disc space. As you can see, that the hole is a half circle from the bone above, and it's a half circle from the bone below. And that hole is always changing in diameter when you move. And when you hear the word degenerative disc disease or stenosis, we'll talk about those in the next video. That hole is where we're talking about. Stenosis means narrowing. That hole gets smaller in diameter, and it can pinch that nerve. Anytime someone uses the phrase sciatica, what that means is that the nerve in this situation is being pinched. And if you take a bigger view here, you can see that each one of these levels of the spine has a nerve that comes out of it. And you see as the bigger nerves run down, and if we zoom out, we can see that those nerves combine together. I'm trying to get a better zoom out. Oh, here we go. These nerves in the last 5 segments of the spine combine to make this big nerve, the sciatic nerve. See that? All these little branches from the last 5 segments make this big sciatic nerve, which travels then down the leg. A pretty big nerve there. But usually that nerve can be compressed in the hip, but usually in the spine, it's compressed in that hole right there where it comes out of the spine. So we can basically have sciatic pain because of nerve compression, or we can have facet pain because of the joints, which is usually more centralized, like in the center of your lower back. What else should we talk about here? Oh, so another area to focus on is this is L5, and this is the sacrum. Okay, the sacrum is the bottom of the spine. If you see, it's like it's the last part of the spine, and the sacrum also has a connection with the pelvis. So here's the pelvis. Here's the sacrum. There's a joint right here, right there, called the sacroiliac joint, or SI joint, and a third type of low back pain is going to be SI pain, SI joint pain. And that means that it's not coming from these segments up here. There's no nerves compressed, but there's pain on one side of the low back, and it's usually a little lower, and it's very pinpointed. You can put your thumb right on it, and it usually hurts when we sit. So we talked about the disc. We talked about the hole where the nerve comes out. Here's a better view without the nerves, but you see that hole right there. Oops. That hole right there is really neat because we talk about stenosis. A lot of people, 80% of people over the age of 60 have stenosis in their spine. that hole right there, a half circle from the top bone. So when you flex forward, for instance, the hole opens up. When you extend back, it closes down. So we spend a lot of time thinking about this hole. We spend a lot of time thinking about these facet joints right here. See, interarticular facet joints. And we like to take stress off of these so they don't get inflamed. We like to open up this hole as big as we can. And then we like to think about the disc and how the disc can actually herniate into that hole and cause compression on that nerve. So there's our anatomy lesson for today. And just want to mention that we are offering this month 10 free screens for people with lower back pain. So if you or anybody you know has low back pain, send them our way and we'll give you a free 20-minute assessment to identify, is it the facet, is it the hole, is it the disc, is it the sciatic nerve, is it the SI joint? All things we can do by moving you and testing you. And hopefully you enjoyed this video.